Thank you for joining us today for this Contagion program. The overuse and misuse of antimicrobials is a pressing issue in the healthcare setting. Antimicrobial stewardship programs, coupled with social media, are poised to educate and engage the world in the appropriate and responsible use of antimicrobials to improve outcomes and mitigate an escalation in resistance to these therapeutic agents. Hi, I'm Dr. Debbie Goff, an infectious disease clinical pharmacist at The Ohio State University Wexner Medical Center.
Hi, I'm John Nostal. I'm a health technology strategist and a contributor for Forbes. My job is to look at how technologies interface with clinical medicine to provide optimal solutions to reach patients, caregivers, and clinicians around the world.
So today we're going to have an important discussion about antimicrobial stewardship and the role of social media. You know, I look at social media. Why is it important to me as a clinician? And there's so many reasons. It gives me the opportunity to engage, educate, connect, network, literally with experts and consumers and patients around the world. And that's an opportunity that no other vehicle provides me. So, John, tell me a little bit, why is it important to you?
You know, I have this inclination to reach into my pocket and pull out my phone and check Twitter or tweet this moment. So, I mean, clearly it allows us to know what's going on in the world with a surprising heft of content. But, you know, when I think about it, when we talk about antimicrobial stewardship, it's such a complicated topic. It's a life and death topic in many instances. So I guess for me, Twitter, and we're going to get into this, feels trivial in a way. You know, it's something for the Hollywood stars, as you had said. So, I mean, let's kind of set the ground on antimicrobial stewardship in the world today. You know, how are we doing? It's such a complicated question. So let's kind of ground it there.
Yeah, we've been doing it for years, over a decade.
Yeah.
And, you know, I always say if it was as simple as reading a guideline or an article, the world would be successful, but we're not. We've made great progress, but we don't have everybody fully engaged because it's so complex. It's not just the healthcare provider that needs to be on board. We need to have patients on board. They pressure us for antibiotics because they think they're feel-good medicine. It solves problems quickly. But, you know, the consumer doesn't understand some of the basics of science, such as antibiotics don't work for viruses. So when you get a cold, people ask us for medication, antibiotics, and it's just not appropriate. But doctors are evaluated, and we have patient satisfaction scores, and people go on social media and make bad reviews on Yelp. So
I mean, the satisfaction score a patient provides to a physician is often a function of getting the script.
Right.
I mean, if I go to a dermatologist and the dermatologist says, just go to CVS and buy hydrocortisone, I'm disappointed.
Exactly.
Right? And I think the same
thing with...
And there
lies the problem.
So help me understand the dimensionality of appropriate use. We have the patient, you know, and Twitter, social media, the consumer empowerment, and they want to know what they're doing, and they want to have a hand in that, you know, the collaborative care, as we say.
Sure.
So if you look at this kind of broadly, where does it align? Is it a office-based problem? Is it a problem in the ICU with a nosocomial pneumonia? Is it a surgical scenario? Is it a little bit of everything? And like, does it stack up one way or another?
So you could just keep going, and I'd say, John, it's all of the above. It's so, and that's what makes it so hard. So I work in the hospital setting, and you know, I used to think when I started this, if I could just get the antibiotics used appropriately in my hospital, I'd have the problem solved.
What does it mean appropriately? Let's define that. Let's start in the very beginning.
So the Centers for Disease Control has already told us, and they've done amazing studies, 30% of antibiotics prescribed in the outpatient setting are inappropriate, meaning they're not even necessary. So patients, or we choose to prescribe an antibiotic for an uncomplicated urinary tract infection, which actually is just colonized bacteria. The patient's actually not truly infected, and we will just treat a culture.
Really?
Yes. And so that's not an appropriate
but it hurts.
use.
I mean, if I'm
well,
patient
now
with
that's
UTI,
different. If the patient is symptomatic, now that's probably a true infection. But asymptomatic bacteriuria is the most common overuse and misuse of an antibiotic in the hospital setting.
So how do they find the bacteria? Is it,
So
is
they,
it just a standard
send
urinary tract?
a culture, and now they feel compelled to treat a lab result. But actually, it's not that simple. You have to look at the patient and put the whole clinical scenario together. So that's the number one cause of overuse in a hospital setting, but it doesn't stop there. To get back to your point, outpatient prescribing. So we know for respiratory tract infections, if you come in sniffling and sneezing and patients want an antibiotic because they think that's what's going to treat them, more than likely the physician's going to give them that antibiotic. It's sort of feel-good medicine. I'm going to make you happy and you're going to like me, and therefore I'm going to do this, but it's actually inappropriate. They do not have a bacterial infection.
You know, it's I want my MTV. You know, if we're even older, it's I want my Mapo. But now it's I want my Z-Pack.
Right.
Right.
And
I mean,
it's exactly what they say.
Yeah.
So that is the behavior that we have to change. So antibiotic stewardship is more than just trying to teach appropriate use of antibiotics. It's about behavior change. So for 30 years you've prescribed this, but now I'm going to try to tell you actually you're potentially causing more harm because you're helping to create antibiotic resistance and the world is running out of effective antibiotics. So you have to stop doing that, and I'm trying to change your behavior. So I always tell antibiotic stewards, that's the psychiatry degree I forgot to get. Because now I have to be able to influence and change your behavior. That's really hard.